Hello, I'm Dr. Helen Pensanti. Welcome to Doctor. With me today is Dr. Bryn Henderson. Thank you, doctor, for coming back. We are doing a series with Dr. Henderson about so many things that he does in his office, Regenerative Medical Group. And this is cutting edge medicine that I personally have never seen in my 35, 36 years of practicing medicine. And I felt that this was needed for everyone to get up to speed because we're in the 21st century now, and this is 21st century medicine. This is not your parents' doctor. This is not even your doctor. This is the future. And he's with me today, and today we're going to talk about plasma-rich proteins. Okay. So, doctor, what are plasma-rich proteins?
Well, thank you. And thank you for the kind introduction. That is a component of the blood products, and it's naturally occurring, and we all have what is abbreviated PRP, and it also has many very, very strong characteristics. The characteristics are because they're innate. Like most things in regenerative medicine, we utilize the body's healing powers to give us the probably best outcomes, better than synthetic, and for sure better than some of the, I would have to say, the supplemental facets, especially the medications, that sometimes don't do as good a job as our bodies do.
Well, where did they originate? Where did plasma-rich proteins originate? I mean, I'd never heard this word until lately, and I'm sure our audience is going, I never heard it either.
Well, the origins are in the body's ability to heal itself, so it's within us. This isn't anything real new. It's just been isolated to help us in many clinical factors. And many factors may be a bad word, many clinical situations. And so what happens here is inherent in how we heal ourselves. We use platelet-rich plasma all the time.
When did it become popular? Did I miss something?
No, I think like many things in life, the athletes who had to have higher performance and had to have a rapid response to injury have given us guidance here. In this area, it was probably Kobe Bryant, because Kobe Bryant had an injury and he flew to Germany and received some PRP, platelet-rich plasma, and what that did is it allowed him to get back on the court sooner and play. Of course, I would say, yeah, very well. He's probably one of the top in the world. But in any event, at that time, and I think the other thing that helped is he was open about where he went, what he did, and we learned from Dr. Wheeling. He went to Dusseldorf, Germany, and Dr. Wheeling was the guy who helped Kobe. And he had the ability to utilize whatever was optimal for him in that jurisdiction. Sometimes our regulations inhibit us from doing what's optimal because we have to catch up with the science. So that's why he did that. That's why he went there.
All right, let's tell our audience how this plasma-rich proteins are made. So,
well, you can see, I think they've got a diagram on
there. There we go.
And that diagram reflects a draw of the blood, which is the common thing like you do in a lab or any other circumstance where you'd have to give blood. So somebody, a phlebotomist usually, could be a nurse, could be a physician, somebody's going to draw that blood. And then it's taken to a centrifuge and it's spun. And so you see on the far left there, you see a whole blood component. That's how it's drawn out of us. And then it's spun, that's that green dots. And then you see it segregate into three factions. The top faction is the plasma. Then there's a buffy layer that's noted there in blue. Most of the time it's white. And then the bottom part are the red blood cells. So it's red. The component we're most interested in this discussion is the top part, which is a yellow hue. And that contains the platelets and many of the healing and growth factors that are then concentrated into another tube so that we can take that syringe and concentrate it into the volume we need for whatever we're going to do clinically.
All right. So who would be the best patients to receive plasma-rich proteins? Who watching would say, you know, I've got this ailment, I've got this, would that help me?
Most of the patients that began using it had to do with musculoskeletal injuries. And then it moved quickly from that into many of the areas of cosmetic medicine. And so we can go through, in fact, I probably can help you with a list of facets of the PRP that help different components clinically and cosmetically.
Okay, I'm here to hear them.
Okay, so if you take the cosmetic first, you know, vanity sells a lot. You wouldn't be surprised on that one, Helen. But in any event, the point is, it quickly became a replacement for some of the factors that are used in vanity every day. For example, ladies like smooth skin. And I'll tell you, PRP does a very good job of making that very smooth. And so once they'd use it, whether it was their hands or their face, it definitely smooths the contours of our skin.
So how do you inject it in the face?
Well, you could, but many times if it's just for skin, you just apply it like an ointment or a gel.
Oh.
Yeah, it's easily done. However, if you want to go after wrinkles and things that are deeper, then you use a very teeny needle, just like the world has come to know Botox. But in lieu of Botox, this is injected in either the crow's feet or the glabella or any of these are called nasolabial folds, and these little guys down here are called marionette folds. It really doesn't matter where the fold is. If you put in the PRP correctly, there's no bruising or other things, and what it does is it fills the wrinkle. So rather rapidly, within days, there's a diminution, a decrease in the amount of fold in that wrinkle. And then how long it lasts depends upon, of course, what you're doing to accentuate it. If you're doing something to cause the wrinkles, smoking or doing whatever you're doing, then it comes back in a shorter period of time. Usually it lasts at least, I would say, 2 to 3 months.
Okay.
That's a long time.
So let's say somebody they don't want to go get a facelift. They can say, I want you to get rid of my sagging things. How many sessions would someone have to look better? I mean, is it like Botox, you get it in a couple of days, you're frozen? So, well.
But this doesn't freeze anything, but it does take a couple. The way PRP works is it causes an inflammatory response to aggregate the body's healing factors and bring it to that area. So it smooths the skin, it eases the blemishes, and it decreases the depth of the wrinkles.
So there's a saying in the Bible that life is in the blood. So now you're taking a portion of life of the person and re-injecting life into a dead area?
Well, it's not dead. Well,
Or dying?
It's definitely dying. We're all dying. But I would suggest that is true. That most things, if not all things, heal in direct proportion to its circulation. So the better the circulation, the better the healing, and the better we will feel in terms of the how much pain and inflammation we have as well. So anytime you can increase the circulation, you're going to have a better outcome for the patient.
Okay, so you mentioned that it could come in, you could just take that and rub it on your face like a moisturizer?
Oh, yeah. In fact, patients do that. They'll come in and they say, I would like PRP for my shoulder, my knee, or my back, and whatever we're going to get to on that stuff. But then if there's anything extra, they want to take that tube home.
Okay, well, what if someone hates needles, which is like probably, hello out there, everybody, probably 50% of the people who are watching, you know, or I've noticed people, if I say to my patients, I'm going to give you a shot, they look at me as if I've just said, stand over here, I'm having a firing squad come to kill you. I mean, they hate needles.
That might be a little dramatic.
Well,
you
it's
know,
a little dramatic,
fiery,
but that's what I feel like, the look on their face. But you're saying if someone doesn't like needles but wants to have their own life of their blood put back on their face to make them look more attractive or
right.
life
Smoother
to their dried up skin, it will work.
Yes, but you'd still draw it. I mean, that's their, and so the other beauty of this is that there's no reactions. It's your stuff.
Yeah.
So there can't be side effects because you're having a reaction to something that's put on you.
Yeah, so I just want to encourage those who say, I don't want a needle in my face, you know, that they could come and have their blood drawn.
Yeah.
You could
Spin it,
make
yeah.
up a little thing for them to take home, and they can use it as a moisturizer.
That's true.
And it's better than a moisturizer because it doesn't have chemicals. It's your own life.
Yeah, many people use that also for eye drops.
Oh.
They use it for eye drops because some people have what they call dry eye.
A lot of people have dry eye.
So dry eye is healed in many ways, and there's many commercially available drops. But if it's your own stuff, it lasts a little longer and it works more effectively.
Excellent. All right, now that we've talked about the cosmetics, let's talk about injuries.
Wow.
Injuries. You see a lot of injuries in your office.
That's for sure. That's for sure. In fact, those are usually classified in different ways. The injuries are usually related to musculoskeletal stuff. So those are the muscles and the ligaments and the tendons. Just to clarify, the muscles help for movement. And there's always an origin, where it begins, and an insertion, where it ends. And then those direct the result of the contraction of that muscle. All muscles require a couple of things for it to work. It's got to have a blood supply, it's got to have neural, and usually lymphatic to clean up the cell's energy sources. So in any event, those are called the neurovascular bundle. But when you get into where we use them the most, it's usually musculoskeletal because we fail as we age and other things to keep everything functional, keep everything working. So if you go to pick something up and you're not judicious in how you do that, then sometimes it aggravates a prior injury or creates a new one. Either way, those can be resolved faster if you use PRP for sure. Now, I don't know if you're going to ask, or many patients ask anyway, how many times will I need this? Well, we had contracts and did a number of these injections in injured limbs. Usually they were knees, backs, and shoulders. And in each case, if they'd never had a prior surgery, so the virgin blood supply is there, they would have about a 70% improvement after a single injection. And then they'd come back in 2 weeks, and they would tell us how much improvement they've had, and we would determine with them if they wanted another injection. That would take it from 70 to 85%, or if they'd like to give it more time, which is fine. If they were there because they'd already had a second and they've gone to 85 and they wanted to 95, young athletes wanted 100. Nothing really goes back to 100. But most of us can improve dramatically with 2 or at the very most 3 PRP injections.
So I notice in your practice, you have a lot of rotator cuff problems where they tear this and that of the shoulder and especially the rotator cuff. You always hear people say, I tore my rotator cuff or something. And so how would you treat that? If someone's at home watching and they say, I was told I had a torn rotator cuff and my doctor wanted to do surgery and I don't want to do surgery, what would your office do? What would you do?
The avoidance of surgery is the #1 reason people to come see us.
Oh.
And the frequency of the surgeries have diminished by at least 80%. if they have the regenerative therapies before. What we would say to them is, let's find out where the injury lies. It's a good idea to know what you're treating.
Right.
So we have the benefit of having an ultrasound in our office with a sonographer, and she's excellent, and they are in each of our offices. And what happens is you have a X-ray or a CT or an MRI, and that is a static film. That gives you a picture. But with an ultrasound, you can move it. So you can see where the tear is, and if you make this motion or that motion, it would gap it more, and you can see the restrictions of the insertion. So it's very, very common in a rotator. The shoulder, remember, has the greatest range of motion of any joint in our body.
I mean,
you can just go all over the place.
I did not know that.
And the second thing to realize on a shoulder, in a rotator, there's 5 different muscles that combine to help us with this massive range of motion. There are some rotator cuffs that include all 5, but it's really rare. It's usually just a couple of them that are screwed up, and they tear them because they were doing an excessive amount of power or a repetitive nature to the motion that takes off the fibers teeny bit at a time. When you tear something like that what's happening is your muscle goes through a band that inserts in the bone. That band is a tendon, and when it inserts on the bone, it looks like little tentacles that comes down. So you can have partial or complete tears of the tendon insertion, but that insertion may be just one of many fibers of that muscle. So it can still work, but it hurts.
Well, I have known people that do repetitive motions, like if they play the piano, or I've known surgeons,
Sure.
or people who deliver babies, and they're constantly using or doing surgery all day long. Sure. And so it could be any kind of repetitive motion.
Absolutely. Probably the most frequent today is computer. Boom, 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 boom. Using your mouth, all that craziness. How about the guys working on the construction? Da, 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 da. Oh my gosh.
Yeah.
It's not only repetitive,
yeah,
but it's intense.
Yeah.
And so but they're doing it every day.
Yeah.
So this isn't some guy off the street, a weekend warrior or something. This man's making a living doing this. He doesn't want to be off work.
Yeah.
In fact, neither does his family. So one of the things you have to do is figure out the mechanism of injury, get the ultrasound and define the degree and extent of the injury, and then you've got to figure out how that's repaired. When you've already harvested or obtained the PRP, so you've drawn the blood, you spun it down, then you take the top part. I said we concentrate it, so we spin it again, and then you end up with a small aliquot of 2 or 3 of those syringes. And then you have to figure out, where am I going to place these? So after you clean it and everything's sanitized, and that's, for heaven's sakes, a big deal, because that can if it's pretty filthy, you want to clean it.
Yeah.
So in any event, you decide where you're going to put it, and then you want to give it time to bind there. So you're putting in liquid that needs to bond to the damaged area, and so it's frequently like a fracture. It's not a fracture, but you want to immobilize it so it has ability to bind and fix those things that are torn. So it's usual that we ask them, don't do anything strenuous for a couple of days. That gives the body time to bind. And it calls in, there's all kinds of signaling, messengers and other things that are inherent in PRP. So they'll call their friends over, essentially, help us fix this tear, and that's what's happening internally.
So give us the top 5 injuries that you see all the time in a week. Give me your...
Well, it depends upon the cause, but the frequency is highly dependent upon what patient population you're serving.
Okay.
If you're talking about the computer guys, that's probably mostly carpal. Okay. Carpal tunnel syndrome. There's a band that sits on the inside, we call the portion in this part of your wrist, and that can have micro tears in it, and after a while it's just repetitive things. And you can see that a lot with people who sew a lot or other things that are always moving those extremities. And it's probably a harbinger of something underneath. I mean, if you have connective tissue disorders, like you have lupus or some other things, then that also would make you a susceptible person to an injury in some area of repetitive action in your body. But back to your question, so if carpal's a frequent one, the knees are by far and away a very common injury. Just think of the task we're asking those knees to do. I'm not talking about just stairs, but all your walking. And what happens when you have a few extra pounds like myself? I mean, then you're packing more weight on that joint. That joint has a lubricant, the synovial fluid and other things in there that has to be met and made, and you either use it or you lose it. And so the knee is a very common area to have injury because we're not staying in shape. The third area would probably be low back. We're going to talk about low back a little later today, so I'll table that. But it is most common that and done by systemic diseases as well, osteoarthritis and gout and things like that. Then when you end up, you're walking up here, and that's to the shoulder. That shoulder's awful common. The shoulder itself, we've just discussed the rotator cuff, but there's all kinds of other muscles there. And you can have injuries, especially tears, the pectoral muscles if you're doing bench press. I mean, it depends upon the patient population in the area.
Well, what about if some person falls and they break a rib and, you're 6 weeks, in pain? Would PRP help relieve the strain of the muscle that also got sort of torn during the fall?
Would PRP help the strain of the muscle? Absolutely. It'll help the fracture. PRP facilitates healing. It has healing and growth factors in it, and it also increases the blood supply because it increases new blood vessels, angiogenesis, new blood vessels to come to that area. So ribs are extremely painful. They have a poor blood supply because it's hidden on the base of the rib, tucked in a little canal there. But every time you move a fracture, no matter what kind of fracture, when you move that fracture, it's like starting over again because it has to bind. So in many areas, the first thing they do is immobilize. If it's a fracture of the leg or the hand or the finger or whatever it is, you immobilize it so that you line things up and it heals correctly. But it also has binding ability of the platelet-rich plasma. Now, when you get into other areas, I would guess the next most common area of injury is neck. Yeah, and of course that's whiplash stuff from motor vehicle accidents and things, but it's also because of the way you hold your neck. If you're looking down all the time, it's a repetitive action going up and down. It is wise, and I think there's even some wristwatches that have beeps on it so that every so often you take a walk or you do your exercise. There's a lot of wisdom in that so that the body heals.
Okay, so we have a lot of times people come into the office, they've had an injury 10 years ago or 5 years ago or even a year ago, and they finally get the gumption or whatever word you want to use to get to a doctor for help. Is it too late? When is late too late?
No, it's not too late. In fact, we frequently help patients with stroke and other things that have been out 10 years, 15 years. So first thing you have to do is just identify where is the diagnosis, where's the problem today? And then you have to stage it. As soon as you figure it out and then figure out the stage, then you move into the prognosis. And then, in other words, what is it going to take and how long is it going to take to resolve whatever we're dealing with? Many times, you take the example I just gave you of a stroke patient, and they come in 10 years after their injury, then we're building muscles. Remember, if you don't use a muscle, you lose a muscle. So many times we're building muscles in addition to helping the brain heal. The majority of strokes are due to a lack of blood supply. There are some pieces of stroke that's due to bleeding, but 80% are a lack of blood supply. So if you have a lack of blood supply in your brain, that means those brain cells are dead. So somebody has to figure out a way to get something in there, and it's usually as a vehicle to the PRP, but most of the time it's regenerative cells, and I guess we're getting into that a little later in another discussion. But then you can infuse them, and those heal. They stimulate growth of new cells. Well, that's true of other injuries as well. So when you're suggesting that it's been a while, 2 or 3 years on a musculoskeletal injury, actually that's pretty easy compared to a stroke or somebody that has a chronic illness. And be cautious of the neurodegenerative diseases. There's some illnesses that continue to degenerate. If they continue to degenerate, then they're constantly having to repair the old injuries and the new ones. So that's tough.
All right, earlier in the show, you mentioned about people being out of, having an injury, being out of work, and they want to get back to work. And we notice that a lot where patients will come in, even if they have a cold, they go, I need to go to work tomorrow and you need to fix me now. Would it work with a sprain or
sure.
like an ankle sprain? People twist their ankles and they don't want to be hobbling, to work.
Yeah, I think there's a lot of wisdom there in understanding the degree of injury, again, staging that injury. But let's say it is a sprain. Sprain meaning a ligament and a strain meaning a tendon. Oh. There's different words they use to essentially mean that you've injured an extremity at a joint.
Okay. That
joint then has to be immobilized. You got to line it up. If the ligaments or tendons aren't lined up right, they're going to have a rough time healing. So usually if it's an ankle, you put it at 90 degrees. If it's a knee, you put it in a position of function. Whatever it is, you have to line it up correctly. Then you go ahead and inject the healing and growth factors that the PRP provides, and you need, again, to immobilize it so it heals in accordance to what the function is of that area.
All right. And in the last minute, what would it cost? I mean, average in our area.
The average cost of a single injection of PRP, to include the blood draw and the spinning and all the nursing that goes with it, is probably between $500 and $600.
Okay.
It avoids the surgery, and the other thing it does is it can be given, like I said, either a single event or double.
Okay. So I hope you enjoyed today's show. I hope those of you who have had previous injuries understand that there is help. You don't have to take pain medicines for the rest of your life. You can get your injured joint, muscle, ligament, whatever, fixed. Dr. Henderson's office is right near the Circle in Orange on East Chapman Avenue, so it's close by here in Orange County. And I want to thank you, Doctor, for coming. I really appreciate your everything. And we will be continuing our series with Dr. Henderson. So please watch each week, and our time slot is available on the TV guide.